My name is Dr. Christian Mazer, and I am a dentist at Allure Dental. I've been practicing for 25 years, and I'm passionate about people who have TMJ issues, TMD, temporomandibular joint disorder or dysfunction, because it ties back to so many things in their lives: fatigue, pain, chronic headaches, vertigo, all of those things. And many times it's also associated with a smile that they're not confident and happy with. So, for us to have the ability to be someone that looks at people more than one tooth at a time, a fielding, a crown, a cleaning, we can look at the big picture. We can help them with these debilitating conditions sometimes major symptoms, sometimes minor symptoms. And in the meantime, we can help them with their smile in the process. So, we're just in such a great position to help people with these problems. Dr. Murray and I have had extensive training in temporal mandibular joint dysfunction disorder, TMJ issues. And we've taken a few different approaches over the years. And I wouldn't say different approaches, but our approach has kind of grown and changed as we have learned more about the process and experienced more cases. Experience, again, how much time we've spent with patients. Our approach now is more of a big picture approach. People make temporomandibular joint dysfunction disorder so very complicated. It's not that complicated. All you have to do is put the muscles in a joint in a place where they're happy, and symptoms improve rapidly. Advanced imaging does help us look at hard structures. We can look at what the fossa where your temporomandibular joint sits in looks like. We can look at the heads of the condyles where, your jawbone sits at the base of your skull, and we can see if there's been bony changes or hard structure changes over time. But interestingly, sometimes people will have a lot of hard structure changes and not exhibit a lot of symptoms, whereas other people might have just minor changes in bony structures and have major symptoms. That's because muscles kind of rule this whole thing. Muscles are going to move things, muscles are going to be inflamed, muscles are going to get out of whack, and it takes time for hard structures to change. So you may be having a lot of symptoms with your temporomandibular joint, and we don't see a lot of hard change. But being able to see that change when it has taken place is advantageous. When you talk about advanced treatments and TMJ treatment, ours actually is more simple than it's ever been. We have spent time doing neuromuscular function, using apparatuses to kind of track mandibular movement, using electrical impulses to stimulate muscles, move muscles, jaw tracking. We've worn semi-permanent devices for periods of time. Now we're in a place where we do where we basically upright mandibular teeth. We get the mandible into a good relationship with the maxilla in terms of how our occlusion works, and everything happens. So it's sometimes made to be more complicated than it needs to be. A lot of the times patients don't even realize they have the problems. They'll tell us they don't have problems. We'll go in and we'll do our process, and they'll be like, oh, I don't have the headaches anymore. I don't have this constant popping and clicking anymore. We're like, well, you said you didn't have that before. Well, you just don't realize. You get so used to living with it. I heard Dr. Murray say this earlier. They're so used to these symptoms, they think it's normal. It's not normal. So getting rid of some of those day-to-day things, it has a huge effect on people. I do have a fun story. I'm a local guy. I'm from this area, and so I know a lot of people growing up. And some of them come to see me as a dentist. Some of them do not. They might know me as a guy on the football team or baseball team or in sixth hour in high school. But a friend had a lot of problems with vertigo for years, and I explained to him how I could probably help him with that. And it went on and on to the point where he said he was lying on his back in his office at work, sweating, all the things, just miserable. And another friend said, go talk to Dr. Mazer. And he said, I know him. And so he came in and we fixed him. And he was just so amazed at the transformation it had in his life, with his family, at work, all the things. So that one kind of stands out because, you don't want to walk around telling everyone, oh, I can help you. You don't want to be boastful. But the fact is, so many people need the help and they don't know where to go for it. They don't know where to ask. They don't know what doctor I go to, who I see. There's so many stories, and we're here. We're here and we do this. And Dr. Murray and I have seen so many patients over the years, so many profound results. It all speaks for itself. And the only way you really find out is to walk in our office and try it out. If you're ready to seek a solution for your TMJ pain, just contact us at Allure Dental. You can go online or you can pick up the telephone and call us, schedule a consultation, and we'll see if we can get to the bottom of things.